Hello, welcome to a new episode of the Healing Hour for the month of May. This month we are talking about the warning signs of autoimmune diseases, and we have our special guest, Albert Baca, head of our Pasadena clinic, as well as Sally Gulliver, who is from our Santa Monica clinic and one of our lead practitioners. Today's topic is really about how do you get impacted by aggravating and continuous symptoms like fatigue, digestive issues, joint pain, or skin rashes? If you're experiencing this, then you might have an autoimmune disease. And what does that mean exactly? It's a condition in which your immune system mistakenly attacks healthy cells in your body rather than foreign invaders. More attention is being given to this topic because of the number of conditions multiplying in the past few decades, and often the symptoms overlap so that it's hard to diagnose. Today, there are close to a staggering 100 recognized autoimmune diseases. People with one autoimmune condition are also at a greater risk for acquiring another. Many factors contribute to this increase happening, ranging from genetics and environmental factors to food tolerance, gut stress, and other contributors. What's vital to understand, though, is that many of these triggers can be identified by paying attention to your body's messages, aka the symptoms we'll be sharing with you today. Warning signs do exist, and this month's episode will teach you how to uncover those triggers that may be specific to you. The sooner you get to the bottom of this, you will feel better, and you have an opportunity to make lifestyle changes to address your well-being. Know that you really can feel good, and it's up to you. So with that, I'd like to introduce you to our speakers tonight, Albert and Sally. Thank you both so much for joining us. I do want to say to our audience, we're experiencing a little bit of kickback from my side. Unfortunately, we can't figure out, or I can't figure out what to do to resolve it. So I'm going to talk as little as possible to give the floor to Sally and Albert. And if you have questions and you're on Facebook, Leah Jonas is moderating, so please type your questions into the chat box and she will pass those over to us. If you are on Zoom, then you have at the bottom of your controls a chat box and a Q&A box. You can write your questions and comments right in there and we'll be able to see them as well. Let us get started now. So thank you for being here. Sally, I'd like to start with you. And can you share with us what exactly it means to have an autoimmune condition and how does one get impacted by this?
Right. So good question. And the intro that you gave us gave a lot of information on, what it means. But basically, the body doesn't recognize healthy cells, and so they get attacked. They think it's a foreign invader. And so our immune system's sort of, you could say, confused. And instead of, recognizing healthy cells in our body, they're actually, our immune system's attacking healthy cells. And so then there are various types of autoimmune conditions that can basically present themselves. And there's other factors, obviously, that will affect someone with autoimmune disease, and that has to do with genetics. We all have different, medical histories, and genetics play an important part. But, in some people, why do these things happen to turn on, and for other people, it doesn't? And I think a lot has to do with our environment. It has to do, with toxins. Unfortunately, we're exposed to so many things now. And also our diet. Our diet is huge. And so it's very important that we are aware of foods that can actually make autoimmune diseases worse. And a lot of those foods are inflammatory foods. And I think we'll talk a little more about that later, but there are definitely things that we can do to help prevent autoimmune diseases from presenting themselves, or if they are present, that we can actually help those symptoms so that they don't affect our daily lives. So that would be probably, what I would say.
Okay, thank you. Albert, maybe you can jump in and share with us some specific examples of autoimmune conditions. And then the other thing I'd like to ask of you is, how does having an autoimmune condition make a person more likely to get another condition? So if you can explain that for us too.
Sure. Well, here's some examples. They say there's 80 to 100. I've seen different numbers, but 80 to 100 different autoimmune diseases out there. But some of the most common would be like rheumatoid arthritis that affects your joints, lupus that also affects muscular tissue, joints, skin, fascia, type 1 diabetes. So when your pancreas is not working to produce insulin in your body that controls sugar regulation, that's another one as well. Scleroderma, it's, skin hardening, connective tissue, inflammation going on there. Multiple sclerosis. Multiple sclerosis is something that affects your central nervous system and it affects your muscles, sensations, and ultimately has, debilitating conditions where you're having trouble walking and moving. Something as common as eczema, so atopic dermatitis. So you see this in, problem areas can be in the chest and the creaks of the elbows, behind the knees, things like that, or behind the ears. And we tend to get a lot of prevalence of children getting eczema, from an early on. So which we have really good success for. I think Sally will talk about that a little later. Hashimoto's thyroiditis, so the inflammation of the thyroid, which eventually turns it into, it kind of attacks the thyroid and it makes you into hyper stage, and then you get to the hypo stage afterwards because everything is just in shock at that point, not working anymore. So those are some examples of this, and like Sally was talking about, it's the cells in your body that aren't quite, that are attacking themselves. I wrote in our last Tao Wellness newsletter, the title of my article was called "Friendly Fire." So it's like our body starts attacking our own defenses there going on. You asked about if we have one autoimmune condition, are we more susceptible to getting another?
Yes.
So one of it's not always the case, but it can happen. And I've read as much as it can happen up to 25% of the time. Now, one of the reasons why is, Sally made an example of gene expression. There is a gene called, PN222, right? So it's in one of the chromosomes in our body, and it affects specifically type 1 diabetes. But it's also the same gene that has a reaction upon rheumatoid arthritis and celiac disease, even like IBS, like Crohn's disease as well. So it's interesting that a lot of different genes express themselves in different ways. But it's not always the case that's going to happen. So we got to look at it on a case-by-case basis. We got to look at it from where a person is in their own healing of what they're going through. If it's the beginning stages, okay, well, let's take care of it and see what's going on, see if we can mitigate some of the problems and symptoms, like that fatigue, the joint pain, the weight gain. I mean, these are some of the symptoms that are very common in a lot of these. But we got to figure out why the body is attacking itself more frequently. And we need ultimately turn the volume down on our immune system so that way it doesn't go on attacking itself going on.
So then based on that, let's kind of segue into this with Sally. Sally, can you explain to us what are some of the challenges of diagnosing an individual with an autoimmune condition?
I think some of the challenges with diagnosing someone with autoimmune disease is that there's a lot of overlapping types of symptoms. So it's hard sometimes to diagnose someone with something specific. But there are definitely, things that we do on our daily lives that I think can worsen these symptoms. And as I mentioned before, diet is really, really huge. We're not aware that we're eating all these inflammatory foods. So I think if we're aware, and that's definitely something under our own control where we can change our diet, but there are definitely things like nightshade vegetables. I think a lot of times when I see patients, they're not even aware what nightshade vegetables are.
I was just about to ask you, can you clarify what that is for everyone?
Yeah, for sure. So the list includes eggplant, tomatoes, which are really like surprising to people that, everybody loves, everybody loves tomatoes, potatoes, and what else is there? Potatoes, what am I forgetting? Eggplant. Oh, bell peppers. Yeah.
So and when you say potatoes, is it Traditional potatoes or also sweet potatoes and traditional potatoes?
Good question. It's more traditional potatoes. You actually want to eat sweet potatoes. That actually has an anti-inflammatory. They have anti-inflammatory properties.
Oh,
So
fascinating. Okay.
yeah, so sweet potatoes are good for you. So yeah, regular potatoes, all sorts of colored potatoes, unfortunately are inflammatory. So something as simple as removing nightshade vegetables from your diet can actually help lower inflammation. And if once you do that, obviously you are helping those autoimmune symptoms. So very important to bring down inflammation. So knowing what foods to eat, what foods to avoid, and then the foods, other foods to avoid include dairy, sugar, and gluten. We know that these things cause inflammation. There's caffeine as well. Once you tell people they can't have their coffee, sometimes, it's hard, but there are other options. But I think diet is huge. And if you're able to make a change in your diet, I think you'll see a huge difference in symptoms, and also preventative for any future autoimmune diseases that may present themselves.
Okay. So what other things, like I'm realizing that our diet then can be something we're doing day to day that we don't even realize is triggering this. Is there anything else that maybe are things that we don't realize we're inadvertently sabotaging ourselves with?
As far as foods, are you referring to foods?
Not necessarily foods, but just when you think about autoimmune conditions, like things that would trigger it, like could it be temperature and weather or something else where we're just
Yeah, well, definitely stress. I mean, stress is obviously going to always lower your immune system and make you susceptible to other things. And sure, we all have stress, and that's easy to say, don't stress out. But I think that there are tools that we can use to help our stress levels. One is acupuncture. So acupuncture is very helpful for stress. Meditating. Meditating is very important, and it's something so simple. And, I always tell people, you don't have to sit for half an hour and think of nothing. You can, do it for 5 minutes or use an app and do a guided meditation. There's so many ways to just calm your mind. And I think that we live in a time where there's so much stress. We just have to know how to sort of work through it. And there's so many tools out there. So for sure, I think, stress is one of them, diet. And I think doing things like exercising is very important. It's also another way to release stress. So there are things that are in our control. We do have genetics. And of course, if we have autoimmune diseases in our family history, sure, we're probably more prone to get some sort of autoimmune disease. But I do think that if we're proactive and we try to prevent these things by changing our lifestyles, I think that we can make a difference and for sure either help our symptoms or prevent an autoimmune disease from presenting itself.
Okay. Thank you. Let's dive in a little deeper then on this diet aspect. Albert, maybe you can share with us, please, why autoimmune diseases often link back to gut health.
When it comes down to gut health, I think of like the intestinal lining as like a net between the intestines and the bloodstream. So when it comes down to if there's holes in that net, then you're getting things going on into your bloodstream that are affecting your body, and now the body's gone like, okay, what is going on? Why are these bacteria floating around in my bloodstream? And then you have the inflammatory military out there, like the cytokines, coming in and try to attack everything. They're like, is this good? Is this good? Is this good? Forget it. You're all bad. Let me attack all of you. It's much easier that way. And so it's having this army attack your own body with that just because we're not taking care of our gut issues is important. So having those microscopic holes in your body, that's just going to create more inflammation in there. And we don't want the bloodstream being overtaken by that. So basically it's attacking other tissues and cells within our bodies. So one of the biggest factors that I see with inflammation, for instance, that Sally was talking about, we got to reduce the intake of inflammatory foods that are hurting our gut and creating more inflammation going on there. So nothing works really as well. If there is inflammation and the body can't digest and transform and transport all the abundance of energies that we need in our body that we're eating. So no matter if our diet can be the best in the world, but if there's a bunch of inflammation there stopping it, it's like having a big boulder in the middle of a river. It's just not going to flow through very well. So one of the biggest things is sugar. With sugar, there's an overgrowth of yeast, and that yeast actually eats away at the gut lining. Okay, so that's creating more. That's creating more like those holes in that net that I was talking about. Gluten and casein, or casein, I forget how you pronounce it. But basically wheat and dairy. Okay. So even whole grains that we talk about. Yeah, small periods, small amounts of whole grains can be good in a sense, but sometimes if we're having a lot of problems with autoimmune conditions, we may even want to go grain-free for a small period of time, just to see what that's going on.
A small period of time.
Sorry?
What would be considered, if we wanted to do that test, what would be considered a small period of time?
2 to 3 weeks.
Okay.
Cut out grains for 2 to 3 weeks and see how your body starts feeling. Example, celiac disease, right? Okay, that's an autoimmune condition. Wheat, barley, and rye they're very glutinous. So wheat, barley, and rye, right? So those have a lot of wheat going on there. The wheat, barley, and rye have a lot of gluten going on with them. So we want to watch out for those guys, because that is creating a lot of more inflammation going on with there. You can sprout the grains, that's better. Organic grains are the best. If you can find specialty stores that have a lot of their grains that are not pesticide laden. Even when you're looking for, wheat, for instance, even if it's sprouted wheat, there's still pesticides that are still floating around in the air, whether they're sprayed after the fact that they're grown, or whether the soils are sprayed prior to the planting. So, and then there's, wind drift and things like that go on. So you're better off just going grain-free for a small period of time doing that. Staying away from a lot of hydrogenated oils. So vegetable oils, canola oil, sunflower oil, stay away from that stuff. Because that tends to get more omega-6 fatty acids, and we want more of a prevalence of omega-3 fatty acids. So a lot of times that can create more inflammation going on there too. Food colorings, additives.
I'm sorry, I'm going to interrupt you again. So for oils, just to give our listeners an idea, then the types of oils we would want to use, is olive oil okay to use?
Olive oil, extra virgin olive oil is fantastic. Olive oil is good. Walnut oil is good in small amounts. Hemp oil. Yeah, hemp oil is good. Those are the ones you kind of want to go to.
Okay, and what could they replace for grains? Like, can they eat quinoa? Can they eat farro?
Quinoa is better. Farro is a little bit better, okay, but farro tends to be a little thick and glutinous as well. So you want to watch out for that. But really, think of, do you really need it, or are you just accustomed to having it?
I know, that's a very good question.
There are, if you're looking for carbohydrate type foods, there's carbohydrate type foods in your vegetables as you go along there too. Like you guys mentioned sweet potatoes earlier. There's a big staple in my family because we can do so many different things with them. If you're looking for noodles, you can make the zoodles, right? Zucchini noodles, things like that. And spaghetti squash, as a spaghetti, as an idea with that, with some good, meat sauce or whatever else. That's all really good. So there, you can be creative, and there's plenty of, websites and cookbooks out there that can definitely help you guys out. But I really got to emphasize the fact of stop eating processed foods. Because that's one of the biggest things I tell my patients, get out of the middle of the grocery store, so if you get the perimeter of the grocery store, that's where your food is. Stay to the left, stay to the right, stay to the back, and so, get
or veggies and fruit.
Yeah, exactly. It's taking care of that. And by looking at that, it's where things are grown, how things are grown. If you can find farmers markets, go to farmers markets, get good quality beef, grass-fed beef, organic, organic chickens, things like that. So that way you can heal your cells and your tissues and start cooking your food and have plenty of fruits and berries and things like that.
Do you feel overall that autoimmune diseases are on the rise in the United States?
Yes. Yeah, I think so. I couldn't find any specific statistics with that. The last one I actually found was 25% more autoimmune diseases, specifically of type 1 diabetes from 2001 to 2009. Okay, so that's a big factor. So you mentioned 25% just 8 years, you got to imagine what it's going to be like now. And I think part of that is what we're talking about. We're talking about, you know, our standard American diet, which is kind of failing our country here, honestly. There's a doctor that I've been listening to. He was talking about having food having meat, as a condiment. You know, so have a condiment size of meat. You know, so have like majority vegetables and having a small portion of it being your protein, your animal meat protein.
Right.
It's animal meat, nor am I. But it's one of those things where, you know, just flip it on its head a little bit. We have too much processed food, too many grains, you know, too much meat and potatoes when we should be mostly vegetables, you know, and have some meat. Have a little potatoes if you want every once in a while, sure, but have good fats, things like that too. But I think part of the idea of people having more of a prevalence of autoimmune diseases in the country now, or in the world for that matter, I think it's a huge factor of our environment. You know, how are we eating properly? Are we sleeping properly? Are we going from thing to thing and rushing from, you know, spot to spot? How is our, you know, electromagnetic field, you know, being what's it called? We have so much electromagnetic fields around us, right? So it's constantly pushing our barriers. So, and everything from cell phones and our computers at all times, earpieces that we're having on. So these are some things we want to watch out for too. You know, the prevalence of our water as well. How good a quality is our water that we're drinking? You know, I mean, there's people, you know, out in Michigan that have a really poor water supply, and they've had it for how many years now? And that's only going to increase as our infrastructure gets worse, unfortunately. So we gotta, you know, do some different things going along with this.
You know, you just touched on something that reminded me of a conversation Lee and I were having, which is bottled water. So many people assume now that bottled water is just automatically good for you. But I can say, as somebody who's been predominantly a water drinker my whole life, I notice the quality of water between brands. And like, there's some waters I drink that are bottled waters that actually upset my stomach. And then there's other water where I know that feels clean and good going through me. And I think that, you know, sometimes we get deceived by the marketing we see going on out there that, oh, just because you're drinking bottled water, you'll be fine. You're doing the better thing.
Right. So one of the things I think about is like bottled water. What is it contained in? It's contained in plastic.
Yeah.
Right.
How much of the plastic leaches in the water? So, you know, having it every once in a while. I'm not a you know, a very strict person in this regard. I do that myself sometimes too. But you got to look at what we do most of the time, not just a little part of the time. We don't have to be, you know, total zero tolerance type of thing, because I don't think that's healthy for anybody, you know, for our psyche for that matter. But you know, we got to watch out for that. And I think a lot of those bottled waters are pH tested, and a lot of them aren't much better than regular tap water, honestly. So they may have a little better alkalinity, but, you know, what are you really getting?
Interesting. Okay.
I mean, I much prefer a bottled water, you know, my flask, you know, doing it that way. That's something you can refill with good water that we have, you know, hooked up on our spouts.
Me too. And I just want to tell everyone listening in tonight, the Tao Wellness clinics actually have some of the best water. Like literally their filter system in there, it is such delicious water to drink. So whenever I come in, I'm like, fill that bottle up.
Yeah.
Take two. Okay, let's switch directions a little bit here. Sally, let's talk about autoimmune conditions and women. What are some of the things that are specific to women's health?
So Albert definitely touched on several of these different types of autoimmune diseases, but there are some that are more prevalent in women. For example, the ones that affect the thyroid, like Graves' disease, is a common one. It's when the immune system attacks the thyroid and the thyroid produces more more of the hormone. And so what happens is it's working faster than it should be. And it can affect other things. It can affect the heart. It can affect fertility. So for women, it's really important to know if there is a history of this, or if they have this condition. Sometimes women, when they're on a fertility path, they start to discover different things about their health, and they discover that they may have an autoimmune disease. And definitely autoimmune diseases can affect fertility. We see a lot of fertility patients at the Dow Wellness, and I would say many of them have autoimmune conditions. So that's important. Hashimoto's, which is the opposite, which makes the thyroid work slower. It also attacks the thyroid gland. So that's another one. Also, lupus. Lupus is a big one. It affects the tissues in the body and the organs, and can be very dangerous.
I think a lot of people don't know what lupus is, actually.
Okay, so lupus is when the immune system attacks your own tissues and organs. So it affects different body symptoms, including joints, the skin, the kidneys, blood cells, brain, heart, lungs. So it's very important to keep lupus at bay, because it can be deadly. And so if I'm not mistaken, I believe that out of 10 people, 9 women are the ones that have lupus. So men rarely get it, although there are men that get it, but it's more prevalent in women. And sometimes it's confusing because there are all these various symptoms that overlap with different things, so people don't know that they have it. So that's another very important thing to know. And also, I was just going to read something here that I read. There was a study done in Sweden, which I found very interesting when I was doing a little bit of research on why women tend to have more autoimmune diseases than men.
Right.
And I thought this was interesting. It says in this study in Sweden, it says that it has been known that there is a link between the male sex hormone testosterone and protection against autoimmune diseases. Men are generally more protected than women, who only have 1/10 as much testosterone. So again, men make more testosterone than women do. And the theory behind this is that testosterone reduces the number of B cells. B cells are a type of lymphocyte that release harmful antibodies. So if testosterone reduces the number of B cells and men make more testosterone, then the theory behind this is that that is the reason why men tend to have less autoimmune diseases than women. We just don't have the same amount of testosterone. Again, this is a theory from this study, but I thought it was very interesting on why women tend to have more autoimmune diseases than men do.
It's interesting that you say that, Sally. I did read that, and I also came across another study you talk about why women are why women have more autoimmune disease, because the double X chromosome. A lot of time the X chromosome is the gene carrier. So you have 2 chances of having that gene going on and expressing itself incorrectly. So
good point. Yeah.
Very interesting points. But we are women, and we're going to stay that way. So what do we do about it?
Yeah, what do we do about it? Again, I mean, yes, there is a prevalence in women, but I think, again, it comes down to how we take care of ourselves, and using preventative medicine like Chinese medicine to make sure that you keep yourself healthy, keep inflammation down, is important. Exercising, diet, all of these things are things we need to do. And let's not wait until, this autoimmune disease presents itself. Sometimes, there's nothing we can do about it, but at least we can try to keep ourselves as healthy as possible and educate ourselves, and know your family history. If you can, if you're able to. I think it's important to know what types of diseases run in your family and what you can do to prevent them before they actually show up. But they definitely are on the rise, unfortunately. And I think it, like, as Albert was saying, it just has to do with our environment and everything that we're exposed to. And we just have to be our biggest advocate and take care of our health and eat healthy and do what we can, to prevent these diseases from showing up. Okay.
So obviously as adults, we're able to self-manage somewhat better. What about for children though? How do we, and is this increasing with children as well? Like, it goes back to what you both were sharing earlier in the episode of things do appear to be on the rise in the United States. So do you see trends with children, and how does one best take care of their children under the circumstances?
Yeah, that's a good point. I mean, it's definitely rising in children as well. I've read a lot about that. And I think it also comes down to how, diet, how are you, what are you feeding your children, stay away from processed foods. I mean, these are things that we can actually control for our children. But I would say I do treat, I treat a lot of eczema. I'm sure Albert has seen a lot of eczema as well in children. And you see eczema presenting itself from birth. We actually, I feel like we've been very successful in treating eczema in children. I feel because their immune systems are still forming, it's a great time to treat it and not wait until they're older. And I've treated kids where I've seen them change, within months. The eczema has just like completely gone away. And I think between the acupuncture, the herbal tinctures, the diet, we have this amazing cream, our MLF cream, which is really magical, and it just really works. And kids just, I just see the change so quickly, and they come in for their treatments, and I feel like we're able to balance out their immune system. And if we catch it early, then we might definitely be preventing this from escalating and becoming a lifelong problem, as well as maybe becoming some other form of autoimmune disease. So I think if we can treat kids early on, obviously make sure that they're eating healthy and all of that, then I think that we can make a big difference. But I for sure have seen a lot of eczema in children in the last few years.
Okay.
Yeah, and it's amazing how, in my experience treating kids for their eczema stuff, then it's amazing how quickly they recover. It's like children in general just actually recover a lot faster than adults because they have a lot less baggage.
Absolutely.
So just the buildup of everything. So, that's part of the reason we don't, for a pediatric acupuncture, as a matter of fact, for those that don't know, we don't put the needles and retain them for half an hour as they lay on the bed like we would adults.
Oh, what do you do then?
We literally put the needle in and take it out. Or we use different instruments where, a needle will pop in and out and they won't even know the difference, like a big pen.
Yeah, I call it my magic pen.
Yeah, I call it my clicker, and I have them do it for me. They're like, click, click, and we make a funny sound, and they usually do really well with it. We have our Acu stickers that you can put on different channels in their body to help relieve itching, reduce inflammation, help their immune system. And
you actually train them through stickers how to self-address where they're feeling that?
Not so much the stickers. I put the stickers on, but I always tell the kids what they're for. So they can always be in charge of their own healing. Because, adults won't do it. Like, adults won't go, oh, yeah, I'm going to pretend a bomb is taking care of this thing and eradicating this, this field right here. They just won't do it. But, if you tell a little 6-year-old boy, pretend there's a missile blasting this rash you got right here every day and spraying it. And he'll be like, yeah, I'm going to do it. So he gets in charge of their own healing process. So that's where it's important.
I love it.
Yeah, it's fun to treat kids.
Yes, I would imagine. And especially you two and your personalities are perfectly suited for it.
Thanks, Tiffany.
It's a joy, honestly. Thank you, Tiffany.
It is. It's fun.
To take it a step back in regard to treating children, we got to look at, for those children that are having problems while still in the breastfeeding stage, we got to look at taking care of the mother.
Good.
Right. So the mother can come in, the baby can have a lot of rash, and they're still breastfeeding. Well, they're not, they may not be able to take some of the herbal medicine or have trouble with it, or in addition to taking the medicines that we give them, whether external or internal, the mothers can also take medicine internally. They can also change their diet, right? So changing them to a yeast-free diet, an anti-inflammatory diet will also be passed on to the child, going along that way.
And what about for mothers that, for whatever the circumstances are not breastfeeding but formula feeding? What is addressed in that circumstance?
That's a good question. I actually I'm going through this myself. Actually, it's interesting. So I just had a baby in December, and and all of a sudden he is on formula, and so we had to switch to a different formula, and he had a reaction, and it looks like he may have a mild version of eczema on his face, and so it just presented itself this weekend. But I give him acupuncture for sure. But it's really difficult with formula because it's all about finding the right formula. And I actually use imported formula from Europe. And the reason I decided to do that was because a couple of times that we used American formulas, and not to say that there aren't any good American formulas, but he had a bad reaction. And I felt like the European ones, they're so strict on their rules and regulations as far as, you know, GMOs and all of that, that I just felt more comfortable. And so he was doing fine on it, but all of a sudden he had a reaction. I don't know what happened. And so with acupuncture, with some tinctures, herbal tinctures, that's what I'm going to do to help him, to see if we can, you know, balance out his, you know, his immune system and see if we can fight this off. But I'm hopeful. I mean, I've seen this happen before, but I think, you know, especially babies, they're so susceptible because their digestive systems are, you know, they're so new and they're forming, and all of these things can affect them. And definitely it happens, I think, more with formula babies than moms that breastfeed. Although if the mom is eating, you know, is not eating the right foods, it can definitely create a reaction in the baby as well. Mm-hmm. So definitely bring in the baby for some acupuncture or acu-stickers or whatever. And we can also provide some tinctures that can just, you know, it's a dropper, you put it in their mouth, or you mix it in with their milk, or the cream. The cream is actually very, very helpful. And I see that cream work like magic. So yeah, very effective.
Okay, that's really good to know.
There was, I'm sorry, one more point on this, because I think it's so important, especially for children, taking care of the mother, you know, taking care of the mother with all this. So taking care of her stress as well. But while a woman is pregnant, for instance, to take care of them there as well. Even taking it back further, right? Detoxing a woman before she even gets pregnant. Yes. You know, right? So I mean, they've talked about finding you know, industrial chemicals in umbilical cord blood. Okay, so it's like, you know, why are they finding, you know, chemicals in umbilical cord blood, right? So that's toxicity from the mother, right? So it's like, you know, and why is the mother necessarily susceptible? So the more, the sooner, the foresight and the, you know, way ahead of time, even before getting pregnant, would be a great opportunity to use, for instance, like our detox program, you know, doing that, right? Before we're getting pregnant, and making sure that the body is optimal to have a child, so they can come into the world even stronger, with a stronger immune system. So the mother can come in nice and strong with, you know, with strong breast milk and having the energy to care for her child. I mean, these are all big things. You know, they even talk about, you know, while pregnant, for instance, we treat a lot of pregnant women, you know, through the first trimester, second trimester, third trimester, even towards, you know, where they're coming into labor. And it's important for them also to see if we can get them to have a natural birth, because actually having a natural birth is better for their immune system, because they're presented to more microbials and bacteria through the natural birth canal versus a C-section where they're not. Okay. So can we help? Absolutely. You know, I think it's important for us to do that.
Okay. I love, by the way, all of these examples that you're both providing, because I think it becomes more, first of all, more realistic to us. And there's tangibles that we can take away as we're hearing you tell these stories. It's like, oh, okay, I understand how to incorporate that then into my lifestyle. Albert, could you perhaps share with us like an adult case study of something that would be resonating well with the audience? And I'm so sorry for saying that. I'm going to just pause you for 1 second and say to our audience, because I looked up at the time, please, if you have questions, start sending them in to us now, because we want to make sure that we cover these for everybody. And we're at 5:45 now, so I know I still have some questions for our doctors, and I want to really be able to give the floor to all of you as an audience. If you're on Facebook, type them in the chat box, and Leah's already starting to text those over to us. And if you're on Zoom, you have a chat box that you can text in as well. Okay, back to you, Albert. If you can share with us a case study, that would be fantastic.
Sure. I was treating a woman who was about 37 years old. She had a condition called scleroderma, and it's a chronic connective tissue. It's one of the autoimmune rheumatic diseases, and it basically comes down to the hardening of the skin is one of the most visible manifestations that it can come on, but it can also affect like the blood vessels. It can affect the organs and the digestive tract. And in her case, her skin was very hard, her abdomen was very hard, her arms were, it was like the tissue itself was very hard to palpate, right? Much less put a needle in. Literally, you try to put a needle in, and the needle would bend. And then the skin was changing color. It was like a darker. She had a darker pigmentation anyway, but it started getting even darker on top of that. She had hands were stiff and swollen. She would always get sick. Her lungs weren't working as strong as they used to be. She'd go through pulmonary function tests, and they were just, it was like having so much trouble blowing into the test. So what we did, and we treated her, we started using Chinese herbs, we started doing acupuncture. They did their test to get a baseline of what was going on. She had inflammation in her lungs as well, and so the muscles were affected, the stomach was affected, and she was getting weak ultimately. So I think in the time that we were seeing her, she had her muscle enzymes were tested, and she was kind of off the chart. Over 1,300 for her muscle enzyme test, and by the time we were done with her, she had it back in range to about 140, and the range of that is like 24 to like 180 or something like that. So she had right in range, within like a year and a half. So none of these things. Well, let me go back. When I say year and a half, she was awesome because she was very compliant. She basically did everything we asked her to do. She was very hesitant to take Western drugs, which were recommended to her. She didn't like the side effects. She had taken some before, and she had a really bad time with it. So some people need it, some people don't. Some people use it and do acupuncture and Chinese herbs at the same time. Some people do either or. So no, there's no one right way or just whatever's right for you. But in her case, she was super compliant. And in that time period, working with her doctor, we had a really positive outcome. And the doctor was, she was really surprised too. She's like, "What'd you guys do? What'd you guys do?"
Very grateful too, I imagine.
Yeah, exactly. So, we've been working with her quite a bit, and she's still a patient to this day. That was years ago, and she's still a patient, being not treated for that anymore, just a slew of other things, so, and just preventative care. So I think that was a good success story. Our rheumatoid arthritis patients, we've had good success with our rheumatoid arthritis patients. One of the biggest things, we talked about environment earlier, cold, damp conditions or hot, damp conditions can definitely exacerbate rheumatoid arthritis. So, bending of the joints, hot, swollen joints. If it's, like you hear that adage of, I know it's going to rain outside because my knees are hurting, it's that type of thing that goes on. And so by taking care of that, by treating the rheumatoid arthritis with the acupuncture, with the Chinese herbs, it's like on a visit to visit basis, it shifts around. So it never stays in one spot. So if her knees or ankles are hurting, her knees and ankles will not be hurting the next time she comes in. Maybe it's a little more transient. So it's a good thing because nothing sticks in that regard. So, and then that quality of that pain diminishes. So that's where we want to go. So that way you're able to live a more fruitful life. I mean, she likes to dance, so, she's going to go, she likes that. She loves going to Dodger games. So it's like, standing up and, cheering on your favorite team wouldn't be an option if she, wasn't having a lot of the treatments that she's getting. And she does have a lot of success with our infrared sauna. Our infrared sauna, the infrared heat goes deep into the cell layer to promote healing in the cells. And so especially that heat, to really kind of, basically microwave our cells, our joints and muscles to help with that. And as well as to help detox, because when you sweat in an infrared sauna, 85% of that sweat that comes out is actually chemical sweat, not just water sweat, versus like going to the gym and using a sauna there. So that's the highlight of having a quality sauna in our establishment. So we have it in Newport, we have it in Pasadena, we have it in Santa Monica. And you don't have to be, you don't have to come in and get a treatment in order to use a sauna. You can come in and go, I want to use a sauna. As long as you're a patient there, you're available to use it. And, I'm telling all my patients to use it, so
Mm-hmm.
I use it every now and again. I don't have an autoimmune condition or like that, but I know like when I'm, have a big workout, or if I'm feeling a little tired, or if I haven't quite eaten so well that last weekend, then those are kind of things that I'll do to get myself even stronger. So you don't have to be necessarily, have a condition in order to use it and feel better.
Yeah, I mean, my family is Ukrainian, and so we were brought up on going in the sauna. I've been going since I was a teenager, and it really is a difference in your body. You feel if you do that on a monthly basis, even one time a month is so extraordinary for your body, what you feel in detox. I'm going to have us wrap up a little bit so we can start addressing some of the questions, but I do have a question for you both before we do that. Basically, what would you want us to be aware of in terms of principles we could walk away from? If you could both answer, just like, what would be that takeaway you want us to be aware of before we jump into these questions?
I'm sorry, say that again. The takeaway from what again?
Like, what takeaway would you want us to be aware of, things that we should be knowing, the knowledge you've shared with us tonight? What's the takeaway? What do you want us to be paying attention to? What do you want us to write down? How do we now better assess within ourselves if we do truly have an autoimmune condition or not?
Okay. Yeah, I mean, I definitely think that if you are feeling unwell, or you feel like, we all know how we know how we feel in our bodies, and when we feel like something's wrong, I think, yes, we should come in and we should, keep track of these symptoms, especially if you come in and you come and see one of us for a consult. We definitely want to know all of your history, find out about your family history, find out if there's any autoimmune diseases, and we can help assess as well. We may send you off to do some blood work. We can do that as well, or send you to a specialist and work together with your Western doctors, because I think that's also very important. But I think that keeping, track of how you're feeling, your symptoms, and making these changes that, again, are preventative, like changes in your diet, making sure you do things to de-stress yourself, meditating, exercise. I mean, all of that is helpful for so many different things. But I do think that we need to be aware that there are a lot of autoimmune diseases. It's on the rise, and that we can take control and do something about it. And very importantly, I think Albert touched on that, is our gut. And our gut is really like so important. It's like our second brain. And so it's important that we keep our gut very healthy, because that is really where our immune system sort of is presented there. And so if we keep our gut healthy, like making sure we take good probiotics and prebiotics, and eating the right foods, eating good foods like fermented foods or coconut probiotics and things like that, we can do things to help our immune system. So I think that that's actually what I would have you take away with is take control of your health, and we're here to help you with that. So feel free to come and see us, and we're happy to help you take a look at your family history and help you manage your daily sort of lifestyle, and how to help you stay healthy, basically.
Okay, thank you. Albert, did you want to add to that?
Yeah, I think my takeaway, one, watch your stress levels. Because find a way to watch your stress. See what your tendencies are. I know for me, sometimes I tend to rush too much. I rush home, and I rush to work, I rush to do this and things like that. So I don't like that about that pattern of myself. So, but when I slow down, and when I meditate more consistently, and I watch what I'm doing, and I'm more alert and aware of what's going on around me, and how I'm driving, how I'm writing, how I'm gripping my pencil, things like that can go a long way. Because I think as our stress levels rise, our immune system dies. And so that's a big factor. So I don't want our bodies to not use what we have available to it, because the stress is in the way.
Okay.
So that'd be one thing. The second would be nutrient intake. Not necessarily in in foods per se, but maximize our intake of nutrients. So what kind of foods are we eating? meat and poultry, lots of leafy greens, things like that. But, vitamin D, omegas, like it's EPA, DHA, zinc. I mean, those are three of the big ones that I kind of give to most of my clients with autoimmune disorders. So that's vitamin D, zinc, and omega-3s, the EPA, DHA, that I think are important for most people. Not to mention probiotics as well, like Sally mentioned, the gut.
Yeah. Oh, Sally, touching on that, Sally said coconut probiotics. What's the difference between coconut probiotics and other probiotics that we see? I feel like there's so many probiotics on the market right now.
I know, that's a hard question. People always ask about probiotics. We actually have a great probiotic that we make at the Dow Wellness. People have said that they feel really good on them, but probiotics is such a personal thing. At least that's been my experience. I mean, there's so many out there in the market. Like, do you have the refrigerated kind? Do you have the kind that's not refrigerated? And I think you just have to try and find the one that's right for you. I know that's difficult, unless Albert, you have another suggestion, but I think that, like, I've tried different ones and I have felt different, I felt better on some than others, but I think just using even things that are more, not necessarily a probiotic, like I was saying, like one of the things is kimchi, sauerkraut. Right. Sauerkraut's really good. Kefir. These types of things are things that you can buy at the supermarket, and it's more, you're getting probiotics through your diet. So that's important too. But I think it's important to keep our gut healthy, and probiotics and prebiotics are important. Not all probiotics have prebiotics. Prebiotics are the food for the probiotics. So you have to read the labels. And talk to someone, maybe when you go to a health food store, talk to someone that knows about probiotics so they can give you some options. But it is a difficult question to answer because there's so many out there, but you should definitely try one. And for sure, if you're taking antibiotics, you want to make sure you take probiotics afterwards, because, you've sort of basically killed all the bad bacteria plus the good bacteria. So you want to make sure you get that good bacteria to colonize your intestines. So that would be my advice.
Okay. I am making a note to myself that we need to do a weekly wellness roundup about the difference between prebiotics and probiotics.
Yeah.
So we will have an article forthcoming on that. Okay, let's open up to questions, because we do have quite a few questions that I know people would like answered. So let's start with this. From our first viewer, what are the best ways to deal with severe chronic constipation? Are herbal laxatives like Cascara sagrada and TCM laxative herbs bad in the long run? What is the most gentle fiber for irritated gut? Who would like to answer that? And tell me if you want me to reread it.
It's kind of a two-parter, so the one thing that stuck out to me was in the long run. I think you don't want to use anything in the long run. I've dealt with a lot of patients that have used psyllium husk, for instance, or Metamucil, and they are just constantly been using it for years and years and years. And what that's basically telling your gut is that your gut just doesn't have to work. Why does it have to work when you're throwing the Metamucil or the psyllium husk at it, for instance? That's just, it'll take care of the problem. You can give somebody magnesium, and magnesium can be very helpful. As watching your dosage, of course, that can also give you too many loose stools going along with that. But I find that's magnesium is my go-to, as well as in my herbal formulas. I put a little bit in there, but we're looking at our spleen and stomach health. We're looking at our liver health. We're looking at our gallbladder health. In those in a condition of constipation, having that chronically. So how are we addressing those? There's a self-healing Qigong DVD that we have, and basically the self-healing Qigong for the spleen and stomach works like a visualization where you're doing a visualization from around your belly button in a circle, and then a certain number of times, then you go back around a certain number of times, and then you do a hula hoop shape around, in the front of your body, like a record player in front of you, and then like a bicycle tire in front of you this way and backwards again. But just using that visualization, using that internal chi that we have and that breath work that we have available to us can be very helpful in helping to heal that. And then again, I keep talking about diet, but why is it constipated in the first place? Mm-hmm. So I think, that's how I'd answer that question. And I'm sure I missed the second part of that, but.
What is the most gentle fiber for irritated gut? But I think you addressed that.
What do you think, Sally?
Most gentle fiber.
This individual is female, by the way, if that helps.
Yeah. I mean, I definitely like, I don't know, not everybody likes prunes, but I definitely think prunes are very helpful in helping with constipation. But I also, being someone, this is, I know it's more information than you want, but I actually suffered from constipation most of my life until I discovered Chinese medicine. And I was shocked how it really helped me and changed me because I thought this was something I was going to live with the rest of my life. But incorporating acupuncture and herbs really helped to regulate my bowels. And now I don't really need to have acupuncture all the time, although I do get acupuncture, but I do have now regular bowel movement, which came really from, I think, incorporating Chinese herbs, acupuncture, and also changing my diet. I think that made a huge difference, but prunes have definitely helped for me, and eating a lot of, leafy greens are important as well. But like Albert said, I wouldn't really try to be too dependent on these things that you can buy at the store. Yes, they're helpful in the moment, but you want your own body to do it, so that you don't become dependent on it. And some people, unfortunately, take these things for too long, and that's never a good thing.
Okay.
So the one that came to me was like apples.
Oh yeah.
A certain number of pectin type of thing, citrus things can be helpful as well. Beans can do that, but that can also be kind of tough on your system. Make you all gassy and bloated. So that's something to watch out for. Yeah.
Okay. Thank you both. Next question. I hope that answered that for that individual. If you need more information, please let us know. Next question I'm going to take from here. This question was, which kind of leads into what you both were discussing, but some more of the over-counter things that we offer, because this individual isn't here in Los Angeles, so they wanted to know, what do they do if they don't have a clinic to go to? What would be key things that are helpful?
Well, I'd just like to mention that we can actually have a consult on the phone, or yes, we can actually even do like a Skype consult. So we're able to treat patients, because we do have patients that are kind of all over the world, and we are able to ship a lot of times, depending on where they live, we can ship herbs. So we actually can provide them with that kind of help. But if for some reason that was not available, definitely we have some actually great books. I don't have one here, but we have a great one on nutrition. I forget, it's the one that Dr. Mao wrote on nutrition. It's got some really great tips on specific foods, so that if you're able to find these foods that can actually help with different ailments.
Nutrition?
The Dove Nutrition.
Yeah. If you can put that in the chat box for them, that would be great.
Yeah, that would be a really great go-to book, because you can find these things probably wherever you live, and heal yourself with foods. But definitely, if it's something that they are able to do, as far as you're able to call and do a consult, we do it all the time, and we can provide herbs. Sometimes we have patients that we can provide them with the herbal formula, and if it's not something we can ship to them, then they might be able to get it wherever it is that they live, if we provide them with what the herbal ingredients are. So there are different ways that we can help patients that are not here locally.
Okay, terrific. Albert, did you have anything you wanted to add to that?
One thing I like to give my patients, and especially inflammatory conditions, is actually something called inflammation fighter.
Inflammation fighter, okay.
You guys see that okay?
Yes.
So inflammation fighter, and one of the nice things about the inflammation fighter, it has papain and bromelain, which are in papaya and pineapple enzymes. So that's really helping a lot of the inflammation that goes on there. It has some other things too, but that's one of the bigger things. Some HCl, things like that too, to help digest. So along with that, the inflammation fighter, some digestive enzymes that we also have available. We have the probiotics. I think, she talked about earlier. That's the probiotics that we have. It's kind of nice because it's, one capsule, twice a day going on that way, to be able to do that. So that's kind of the go-tos. I talked about the self-healing Qigong DVD earlier. I think that's important.
Yeah, I wrote that down as well for you.
Yeah, to take control of our own healing. I think that's important. We have a lot more capacity for healing than we think.
Okay, thank you. I hope that helps that individual. I'm going to move on to the next question now. This one, what are the best ways to treat fibromyalgia while you're waiting for an autoimmune diagnosis that can sometimes take years to confirm?
Yeah, fibromyalgia, it's tough, right? Because a lot of times people get diagnosed with this because they really don't know what is wrong with that person. So fibromyalgia is usually that go-to diagnosis. But yeah, most of the time people with fibromyalgia are suffering from pain and fatigue. And so we treat a lot of people that are suffering from those types of symptoms. As Albert mentioned, the infrared sauna, I think, would be great for someone that has fibromyalgia. Herbs, acupuncture. I mean, there's definitely ways for us to treat that. And yes, it's true. Sometimes it can take a very long time, unfortunately, to get diagnosed with an autoimmune disease, but that doesn't mean that we can't treat the fibromyalgia symptoms.
Okay, thank you. Albert, did you want to add to that?
Fibromyalgia, you see the cardinal signs of, different tag trigger points along the body for the fibromyalgia. So it's a lot of pain management doing along with that. So one, learning how to deal with the pain. So guided meditations can be helpful. Gentle exercise like yoga and Tai Chi, acupuncture, of course, watching out for those things. So the more you can do to manage your pain and pain levels going along with that. Light movements, I think, are super important, because when the chi gets blocked, then that's when there's pain happening in your body. So circulation gets blocked, that's when there's pain. So you want to do as much as you can without going overboard and making yourself more painful, unfortunately. So, but come in and see an acupuncturist. They're very, very helpful with fibromyalgia.
Okay, thank you. I hope that helps. Certainly ask more questions if you need to. General rule of thumb: if we didn't answer your question completely, let us know. Okay, next question. I've been a shift worker for a very long time, and it's not easy to change the circadian rhythm. Is it better to leave the rhythm as it is, or is it really all that important to be up at 7 a.m., sleeping at 10 p.m., etc.?
In an ideal world, I guess, but like I said, we can't be zero tolerance and not live our life the way it is.
Right.
If you can't do it, you can't do it. So what are you going to do? You got to just make sure that make sure that the rest you're getting is quality rest, so the body can recuperate itself.
Yeah.
So maybe 7 o'clock isn't your time, but maybe you get up at 10 and then say, okay, you gently proceed through the day instead of jumping in or rushing back into the day. I think that's a big part of it.
I remember too, Albert, when we were talking about sleep a couple of months back, you said to get those blinds, the special blinds that block out all the light. And,
oh yeah.
Blackout curtains.
Yeah, blackout curtains, and turn off all the devices, like really make it that quiet sanctuary so that it feels like you're having that sleep deeply that you need. Absolutely.
I think that's a great point.
Sally, did you want to add to that?
Yeah, I mean, I agree with Albert. If this is your schedule and this is your job and this is what you have to do, then you work with it. Yes, I mean, ideally it would be nice that you do get your hours when you're supposed to. There's certain organ systems in Chinese medicine that say, you should go to bed, say around somewhere between 10 and 11, because then, from 11 to 1, the liver system is doing what it needs to do. So, but I do think that, you do what you can with your circumstances. And I think things like the blackout curtains are great, because you have to sort of tell your brain, okay, it's time to sleep. Let's produce some good melatonin. So whether that's at, like you said, 7 or 10 or whenever, create that sort of environment so that you do get that good restful sleep that you need in order for your body to heal.
Okay, terrific. So we have one more question. If anybody else has a question, please post it for us now so we can catch you. Otherwise, we're going to be concluding after this. The last question that I have is an infrared sauna with jade really more beneficial than a traditional infrared sauna?
I don't know.
Yeah, I don't know either.
I don't know enough about the jade sauna, honestly, to give you a real answer on that. So.
Yeah, neither do I. I mean, I think the infrared sauna is in itself very healing and good for you to do. I don't know what the jade properties are. I don't know.
Yeah, I mean, there's very many, I can answer this a little bit because again, I've been doing sauna for many years. And what I would say to you is the jade does have healing properties. It's supposed to be very balancing to go into a jade sauna. Is it better than the type of infrared sauna we have? Not necessarily, it's just different. Other types of saunas that I've been in are Himalayan salt saunas, which are very detoxifying because it's drawing those toxins out of you. With the salt, it's usually a roof of salt and walls of salt, so you're completely enclosed in bricks of Himalayan salt. There are oxygen saunas where they use a very specific type of wood that again is detoxifying, and it's also oxygenating for your respiratory system. And then of course you have your dry sauna, your wet sauna and whatnot. But I have to say our sauna at the clinics is exceptionally good. You know, obviously they did a lot of research on this and wanted it to be very beneficial for the patients.
Thanks, Tiffany.
You're welcome. Every once in a while I have an answer to feel worthy too. Okay, well, I think we are ready to wrap up. If anybody else does have a question, please always feel welcome to send an email to marketing@infinity.com, and I will pass that over to the doctors so that they can still respond to you. But for Sally and Albert, is there anything else you would like to conclude with as we finish up for tonight?
You know, I would just say again, be an advocate for your own health. You know, there's so many ways that we can help you or ways that you can help yourself. So, you know, just take control over your health. We have some wonderful books with different sorts of tips and ideas and foods and recipes. And we have a ton of amazing articles that have been posted on our website that deal with all sorts of different types of autoimmune conditions and all sorts of different diseases. So take advantage of all these tools and all this information that's out there for you. And we're always available if you have any questions about anything or something we may have not answered today. So hopefully you all got something good out of this, this talk. Thank you.
Thank you so much, Sally. And Albert?
The thing that came to mind was make small changes, and that small changes are very important, and they're tangible. They're little bite-sized changes that you can make because they'll last longer when you make them and you make them consistently. So maybe it's just drinking more water this week. Maybe it's adding a probiotic. Maybe it's walking 10 minutes a day, whatever it may be. But just maybe add 1 or 2 things this week and then see how it goes. And then maybe next week or the week after, add 2 more things and see how those go. Because nobody changes anything overnight. A condition, especially an autoimmune condition, isn't going to change overnight. It takes steps and it takes perseverance. And like Sally said, research and take control of your own health. But that's something that I like to give my own patients is just, hey, take a couple things, see if you can make them your own this week and see how it feels. And then be aware. Really be aware of how you're feeling with that change. If it's an extra hour of sleep at night or going to bed half an hour earlier, how do you feel the next day? Mm-hmm. Are you more alert? Are you speaking more clearly? Are you less, or are you more patient? Things like that to watch out for and see how it goes, and then start making those changes that way.
Okay. Thank you. Very good advice as well. So it was such a pleasure to have you both on tonight. I love being able to have you, and I love having you together. This is really fun for us too because we missed Sally. We didn't get to have Sally for a while. So
agreed.
I'm happy to be back.
Wonderful. Okay. Well, thank you to our viewers for joining us tonight. We hope you really enjoyed this episode. We will be back on the first Monday in June, which I believe is June 3rd, with dear Dr. Mao, and he is going to be talking with you about weight wellness and getting summer ready. So we hope you'll tune in for that. And our theme overall for the month of June is men's health. So we will have many wonderful articles about this, as well as several upcoming chats in regards to that too. I just also want to point out that at the very beginning of the episode, Albert had mentioned that he wrote an article relating to autoimmune conditions. That can be found on the Dow Wellness website. We have an archive, and any of our previous articles from newsletters are always located in there. So you do have access to that if you'd like to read his article.
Yeah, Sally wrote an article on that same newsletter as well. So
there you go. So double the dose of pleasure. Head over to our archive and you can read both of their articles. And they do have upcoming articles actually in the next newsletter too. So please stay tuned for that. Okay. Thank you, everyone. Enjoy a wonderful evening, and we will see you back again in June.
Thank you, Tiffany. Thanks, Sally. Thanks, everyone, for joining us.
Bye. Bye.
Bye.